filming Chris's presentation here in Bosland, in Orange Farm. I'm in Scrolls.
Hello everybody, Dumelang. Hello, I'm Chris Scott. I'm a pediatric rheumatologist from Cape Town, South Africa, at the University of Cape Town in the Red Cross War Memorial Children's Hospital. But I'm here today because I'm a member of the Global Task Force for Pediatric Musculoskeletal Health, as well as the Tin Soldiers Patient Finding Organization. The Global Task Force for Pediatric Musculoskeletal Health has the mission of advocating and improving the care for children with rheumatic diseases and musculoskeletal diseases all over the world. We have a network of approximately 450 regional thought leaders who are healthcare workers in pediatric rheumatology and in musculoskeletal health. And through this network, we disseminate information. We identify projects that we feel would improve the care of children all over the world. So one of the biggest challenges we have, though, is really getting people to care about musculoskeletal diseases. There's a lack of insight into what it means to have a musculoskeletal disease, not just amongst the public policymakers, but also amongst many healthcare workers. And we feel it's really time that that changes. Yo, this is scary.
I know. Very makeshift.
We are looking for people with a rare condition called FOP. Fibrodysplasia ossificans progressiva is a condition which is extremely rare, but because of the risk of harm being done to children who don't have a diagnosis, there was a moral imperative to identify these patients. Patients with FOP should never be biopsied, which is something that frequently happens in the early days. If you see a child with funny toes or with lumps on the back, don't send them to a surgeon for a biopsy with FOP, because the prevalence is 1 in a million, and we know of far fewer than 1 in a million people in the world with FOP. And we anticipated that these people would be living in places of the world where healthcare is scarce or is not easily accessed. And so was born this harebrained scheme of trying to find patients with an ultra-rare disease in places such as Africa, and to identify them and put them on a pathway to care. And so we set ourselves this task of doing that. But how do you do this?
I think from the first day she was born, the doctors could notice the toes, but because it's an unknown disease, they couldn't diagnose her right there and there.
So it was created this methodology of telling stories of patients, using those stories to create an awareness and to create publicity around the stories.
Just take us through the process. How does it start?
This new skeleton tries to develop in exactly the same way as the original skeleton.
Activating networks of people who care to be able to actually deliver care to patients. And this methodology actually seems to have worked really well. It's exceeded all our expectations. One by one, leads started coming in, and the team started following up on these leads. At the same time as following up on these leads, of course, there was this creation of the pathway of care, or this improvement in the pathway of care through creating a network of doctors with an interest in FOP, so that when we got a patient, we immediately set about finding a route of care and then getting that patient to actually have care for their FOP.
Ek toon hierso kan glad nie buig nie, nee.
Nee. Ek het nie eens geweet daar is 'n nakkel wat daar kan buig nie.
We found some amazing examples of patients with no access to care who, through this process, have been able to access some of the most advanced care in the world for this ultra-rare disease that really only people involved with this disease passionately care about.
Gaan dit probleme veroorsaak of nie regtig nie met die FOP nou?
Nee.
Okay.
Nee.
That was Tin Soldiers. It became this movement with a life almost of its own, with all these energized people and networks.
We need to know that all the clinicians are on board with it.
That really translated into benefits for children in parts of the world that you cannot imagine.
Sy rugwervel wil voel asof hy so bietjie prominent is hier, soos jy gesê het.
Some of the highlights for me along this Tin Soldier journey about finding people have been finding families who had abandoned all hope that they'd ever have care, finding multi-generational families with FOP, being called up about a set of twins, where it turns out there's a diagnosis of FOP from a fairly rural part of South Africa. Children who would otherwise have walked this incredibly sad and destructive journey towards a diagnosis are now almost snapped out of obscurity and placed on a pathway to care that's going to really impact their lives and the lives of the family members who care for them. Another highlight has actually been finding patients who don't have a diagnosis but have other conditions and doing the same for them. So finding patients with juvenile idiopathic arthritis who had been struggling to access appropriate care for years and who contacted Tin Soldiers thinking they might have FOP. Finding children with even more rare conditions. And some of these stories will be told at the symposium. But those are tangible, measurable outcomes that I'm incredibly proud of, actually, to be able to put these children on a pathway to care. I've always say, if you can help one person, that's enough for that person, then that's probably enough for all of us. The scale doesn't matter, but then you start thinking about possibilities of the scale. And you start thinking about how many children there are in the world, living in parts of the world, that are not able to access basic medical care for even fairly common musculoskeletal conditions, such as juvenile idiopathic arthritis or clubfoot for that matter. These conditions are much more common than FOP, and yet there are literally tens and hundreds of thousands of people in the world who are not able to access pathways of care for these conditions because of a low level of awareness of healthcare workers and trouble accessing the system, and just a low level of popular awareness of what the possibilities could be if a child isn't moving properly. So I'm looking from the front here to see if I can see any asymmetry. So we're looking if the hands are the same, the hips are the same, the legs are the same, and then you're looking specifically at the toes while he's standing as well. Tin Soldiers was started in South Africa, but the methodology is now being adopted all over the world. It's going to South America, Russia, Pakistan, India, where the biggest populations on earth live, and where one of these, for instance, children with FOP, who, if there's one born every 44 hours, you know, the most people in the world are being born in those areas, and that's where we're going to find those patients with FOP. So you always want to see that there's a normal T here. And if it goes like this, then you know there's a problem. People are so receptive to this kind of methodology because you find the right people in the right area and they're on the same mission as you, and offering people a tool to be able to fulfill that almost drive that they have is so powerful. This boy's leg, who can tell me what the problem is there? If we could do this for a rare condition such as this on our continent, what is the potential for other conditions, for things that we also know is out there, things that we know are not being diagnosed, things where we know there are limitations to access, where fairly basic levels of education, fairly straightforward, nuggety kind of interventions can really translate into benefits for patients and have them seen for the first time on a scale that we haven't seen in musculoskeletal diseases before. I think the potential of that excites me incredibly. And it should make anyone working in musculoskeletal health very excited, because we all know our biggest challenge is finding the patients. We all lament the days when the patients come in. It's like, I was referred a child today with dermatomyositis who's been in care for 18 months without a diagnosis, being diagnosed with eczema, for instance. You know, this is what makes a pediatric doctor's heart beat, is finding the patients and giving them early access to therapy. This is what we want, early diagnosis, early access to therapy, a pathway that actually works. And this methodology worked so well for Tin Soldiers. If we could expand this to include other conditions, we could really make a global difference and we can have measurable impacts. Those are the tests that I have to do. This Tin Soldiers model has shown the potential. It's roll-outable, it's ready for the world, and it is being adopted by the world.